Let's move on to Kathy Madden, who, in my opinion, is the definitive nurse practitioner. She's an outstanding individual, and she's going to talk about psychosocial issues related to melanoma patients. Kathy, it's all yours.
Hi, everyone. Thank you, Dr. Weber, for that intro. Let me just get this into slideshow for everybody. And thank you to AIM for inviting me. And it's always a pleasure to work with you in the organization, as well as all of my physician colleagues and all of you out there at wherever you are, at home or with your devices. Thanks for joining us today. So the docs have really done an amazing job at sharing with you all of the strides that have been made and the processes and how we get to treating patients and talking about survival. So what I'm going to talk about are more about the critical psychosocial issues for melanoma patients. And I would like to expand upon that survival that we talk about in terms of treatment and diagnosis and surgery and all of the interventions that we do, and shift it into survivorship. So looking at how people live, how they're doing with their diagnosis, and at different phases of treatment. The word survivor, it's often used in different ways. There's different definitions and meanings that are put to it. But for today's context, I would like to use the bolded definition at the bottom from the NIH, which defines cancer survivor as an individual who's considered a cancer survivor from the time of diagnosis through the balance of his or her life. Family members and friends and caregivers are also impacted by survivorship. Oops. So let's talk about, now that we have the context of that survivorship, the phases and the seasons of survivorship. As more people are surviving and living with cancer, the focus has shifted from just focusing on how long a person lives to include how well are people living. And there's 3 identified phases per Fitzhugh and Mullen, and these are designated as an acute survivorship phase, where cancer treatment is focused. It begins at diagnosis, it goes through the end of treatment. There may be some fluidity between phases because some treatment is ongoing. And then there's the extended phase of survivorship. This tends to be a fairly long phase after that acute phase. This focuses on the effects of cancer and cancer treatments. This phase begins at the end of treatment and continues through months after. So that's really in the context of somebody who maybe had a surgical resection, and that's with the intent of curative, someone who may have completed adjuvant therapy. But I don't want to discount and dismiss our folks where this phase encompasses living with disease and being engaged with ongoing therapeutic treatments. And then we shift over to the permanent phase of survivorship. This is the much more longer continuum phase that encompasses where years have passed since diagnosis and treatments, and the risk of recurrence seems less likely. So the path to recovery from melanoma does not always end with medical or surgical interventions. There can be curing plus or minus healing. And you're kind of like, Kathy, what's the difference? So curing, can be a very clinical sort of aspect. You can be rendered free of disease. But healing is an ongoing process. And you can have curing and healing, or you can have curing without healing, or you can just have healing even when curing may not be a possibility. So the focus of my context today really is talking about more of that healing aspect and looking again at that psychosocial aspects of our patients' needs and really rounding out all of the perspective for today's talks. About 30% of melanoma patients reported psychological distress symptoms when asked. The majority of those were anxiety and depression. Persistent levels of psychological stress may present as a range of potentially debilitating symptoms, such as excessive worry, concentration issues, ruminating over things, just having trouble kind of getting past that. Insomnia, somebody might say, no, I'm fine, I'm not worried, but I'm not sleeping. So these things can manifest in very different ways. Sometimes some of that coping mechanism can be a bit of an avoidance using alcohol, maybe an increase of alcohol, other substance uses, increase in smoking if someone's already a smoker, and potentially withdrawal from social or emotionally based activities. So, people experience things differently. Each individual has different resources and experiences, and those play a role in how they are affected by different emotions. Just as not all people feel joy the same way, not everyone feels pain the same way. And a lot of this relates into context of perspective, seeing the same things differently. And there's a little cartoon right down there that just says reality can be so complex that equally valid observations from differing perspectives can appear to be contradictory. So you can see that on the little figure on the left, it says that there's 4, and the figure on the right says 3. They're both very valid perspectives, but again, seeing the same thing differently. Or, is the glass half full? No, I'm good. You know what? I could always use a little bit more, but I'm okay where I'm at. Things are good. Or is the glass half empty? I need more. This is not enough for me. So these are really, really important perspectives to keep in mind. Where is someone at? And those perspectives can change. They can change day to day, week to week. Sometimes they change hour to hour. And meeting those challenges and being aware of where that comfort zone is, and the willingness to allow that comfort zone to maybe be a little bit more fluid to bring in what someone needs. So some of the presentation of psychological distress most often can be during that initial diagnosis phase, that acute phase. And some of the things that come up that people might say, am I going to die? But I'm a fighter and I can't let this win. I just can't. So these are phrases that can come out, or thoughts that people might be exploring and experiencing. But as they mature into their diagnosis, as they mature into their cancer experience on that continuum, into the extended phase, they'll make comments like, my life is very different since my diagnosis. Treatment's done, but where do I go from here? I'm worried that my melanoma will come back, even though it's been a while. Am I cured? Can we just, can we help my calibration of my perspective here? I don't know what I'll do if I don't come to the office. It really makes me anxious. There are those folks who maybe, let's say, finish adjuvant therapy and they're like, see ya, 3 months, or at their next visit. And then there's other people who are like, oh my gosh, this is like my social time, or I really feel like I'm coming here and I'm doing something. I know that something's being done for my cancer, and it really makes me anxious to kind of like let the rope extend a little bit. So just meeting people where they're at and taking their verbal cues, and also just checking in with them. Some of the other questions that people ask: how long will treatment last? How long do I have to live? It's important for me to have things done in order to have peace of mind, and honoring what comes up for people at those time points is really, really important. If somebody who may have an early phase diagnosis, stage diagnosis, wants to talk about issues about getting affairs in order, or just making that just may be their personality and that type of person. So it's important to honor what comes up, but also invite them in and create perspective and talk about goal setting. So some of the coping styles do vary over the course of illness and a wellness continuum. And I use the word continuum very, very specifically because, I think we tend to compartmentalize things into episodes, and they certainly can. But, we're a bunch of episodes and a lot of series and a lot of seasons. So it's really a continuum of growth and ongoing. And sometimes we have bumps and highs and lows, but it still is a continuum. So active behavioral coping, this is dealing directly with the cancer and its effects. Oftentimes, we rely on other people for support with this type of coping. And then there's also active cognitive coping, where one's own attitudes and beliefs and thoughts about cancer really play a strong role of support. And then there's avoidance coping. Sometimes this is a positive, sometimes this is a negative, but it always serves a purpose. actively avoiding or dealing with illness or issues at hand, and using a form of distraction as a means of avoidance. Sometimes people need that. Sometimes we all need that. We just need to distract a little while. Like before I sat down to write this deck to present to you, I had to make sure that the plants were all watered, and little distractions here and there until I could really kind of get myself into taking care of what was needed at hand and my full attention. So some of the effects of melanoma treatments can be very challenging, and they can be sustaining and stay with people for a long time. Typically, patients who have surgery, maybe followed by radiation or systemic therapy, immunotherapies, targeted therapies, experimental therapies, even chemotherapy, and there can be some long-term sequelae from the disease itself. Utilizing active coping practices can influence quality of life and function. So some of the toxicities people may have longer term issues with, maybe GI, pulmonary, dermatologic. Some of those derm issues can be very obvious, where they might have vitiligo, as noted in the photos. Cardiovascular issues, endocrine issues, that's a big one, especially with immunotherapy. They can be anywhere from hypothyroidism, to something as serious as insulin requiring diabetes. Neurologically, peripheral neuropathies can be an issue for patients long term. And other potential long-term issues for patients that can be real as they're on their continuum journey. Dental issues, loss of taste, ongoing fatigue, chronic pain, joints, arthritis type of things, osteoporosis, talked about depression and anxiety, PTSD, that's a real thing. And I think it's getting a lot more attention, especially during the pandemic, that it really does have a broader reach. Psychological stressors such as family, work, friendships, medical appointments, altered body image, sexual dysfunction and reproductive issues, financial stresses, bills, insurance, transportation, additional costs related to having a cancer diagnosis, racial, ethnic disparities, and pandemic-related issues, very current, isolation, increased fears and uncertainty, and interruption in healthcare provision. So we can't just talk about the patient without speaking about the caregiver experiences. And I think it's very important, and it's inclusive in the NIH definition that I shared in the beginning. Patients and family members, friends as caregivers and support team, they may go through periods of transition encompassing, again, psychological concerns. Living with uncertainty is a big one. And I think we're feeling that globally at this time. Even outside of cancer, impacts on roles and relationship changes, sexuality issues, physical care, finances, spiritual faith, existential concerns, asking some of those really deep questions, and focusing on hope and what's next. Some of the financial concerns I just wanted to just expand on a little bit more, because that's a real issue that I think doesn't always get as much play and as attention. And patients are sometimes willing to sacrifice some of those issues because it's my life, whatever it costs. And, again, we're in this for the long journey. So sometimes these things can add up, especially if they're not discussed at the onset of where an issue may occur. So medication or medical copays, insurance deductibles, over-the-counter medicines, paying for assistive services, things during diagnosis, treatment, and even afterwards, childcare, housekeeping, gardening, things that maybe a patient or a family member, a caregiver was engaged with, but can't do because they're focusing on the patient, or the patient's focusing on their recovery. Lab tests, increased utility bills, maybe somebody's at home or they're utilizing services at home more over longer periods of time that result in higher costs. Special foods, cost of insurance premiums, unanticipated expenses, ensuring things like FMLA, transportation costs can be a real hidden issue that comes up very quickly. Mental health, billions of dollars are spent on research, and very little of it is channeled into mental health research. Again, I think that a pandemic positive, if you will, is that so much attention is being paid on mental health research. So I'm very optimistic and hopeful that that will translate to all types of healthcare issues, especially cancer. Some of the life choices that people have opportunities to make decisions in, and things that they have to deal with. Utilizing coping, active coping is really important. Things like intimate relationships. So we have some very young survivors or younger folks who are on treatment, and they're looking to have some sense of normalcy. They want to date. They want to develop relationships with friends and other people. So being sure that we're there to help them engage with those types of activities as directly as possible, and supporting them on that journey. Folks who are married, sometimes or in a committed relationship, sometimes those roles shift, and that can be kind of challenging. So utilizing that active coping is really important. Family planning for a couple who has moved through cancer therapy and looking at starting a family. So when to open up with those intimate conversations can be challenging. Returning to work. Some of the evidence and literature said having really good communication with colleagues and supervisors is essential to reentry into that job place and having that support from them. Privacy surrounding medical information. Not everybody, would like to advertise or share or be as candid because they just want a sense of normalcy while adapting and living with cancer. So some of the behavioral changes that melanoma patients can incur, and again, using an active coping strategy to directly deal with this, is sun protection strategies can maybe shift. Being faced with mixed emotions and confronting them about outdoor exercise and sun exposure or potential of activities, and just being mindful with that relationship with outdoor and potential UV exposure. I had a patient one time, one of his passions was boating. And when he had a melanoma diagnosis, and he ended up being a curative situation, which is amazing. But he just said he got so nervous about being out in the sun, he ended up selling his boat. We encouraged him to try to find a median ground there, but that was within his comfort. And that was and he felt empowered by making that decision for himself. So, of course, we were ultimately supportive of that. Concerns for recurrence or development of new melanomas, concerns for the health of relatives and their futures, promoting healthy lifestyle changes, nutrition, smoking cessation, exercise, and stress management. These are things that people can actively engage in. And the survivorship wheel, I really like this because I think it does really illustrate how everything is directly connected, starting really with goal setting and making sure that we're taking care of all of the aspects and presenting patients with the aspects that evidence has supported that are important, things that other patients before them have identified as important, but also staying flexible that as this continuum moves and shifts, sometimes things may be a priority at this point in time, or it may shift back and something that was a priority in the past becomes a new priority along the continuum. Regular wellness visits are really important with primary care providers, immunizations, mental health assessments, and surveys. For example, at NYU, as every time we do an intake with our patients, one of our screening questions that is required is a depression screening. And it's usually just a very quick, we can usually engage that with our assessments and just seeing how someone's doing. But we can expand that survey as needed to meet those needs and look at making a referral. And also integrative care approaches, stress management, mindfulness, connecting with things that really bring someone peace and bring them some groundedness, and also trying some new things. There's a lot of stuff out there available. Social supports. So let's shift over to that. Research supports that sharing thoughts, emotions, and concerns led to enhanced quality of life and better outcomes for many melanoma patients. So that can look like psychological support with trained professionals or supportive care referrals, group support, oncology team direct support, personal support network. spiritual and faith-based beliefs, using active cognitive coping to support oneself and inner and external strengths, enhance feelings of well-being connected to something greater than oneself, and greater connections to a support faith-based community. Ultimately, at the end of the day, whatever the individual says are the most critical issues, then those are the most important issues at hand. And again, they may shift and flow and come up again, or may be completely resolved. The presentation that I provided you with, it has a lot of research and literature and evidence that has supported things that have helped other patients, but ultimately it's what you say it is. And in order to make a permanent change, being willing to see things differently, willing to experience new ideas, willing to listen to the people who cheer you on rather than the ones who echo your fears. I found that really important. So some points to remember. Healing is always possible despite your disease status. Focus on longevity and living well, maintaining hope and dealing with uncertainty. Engage strategies for managing symptoms related to diagnosis and treatment sequelae, just focusing on quality of life. Advocacy for resources to address mental health issues and burdens, utilizing standard evidence-based practice guidelines for management and health promotion of melanoma patients. And ongoing medical and nursing research is really needed to support programs and augment resources for patients and caregivers. And this is certainly not an exhaustive list of support resources. These are some of the most patient-friendly and popular ones. I've certainly bolded AIM. I was on there last night just perusing some of them. And there are all kinds of support options and different menus that take you to different sites. So if you have a need, type it in, go to one of these sites, check it out. It doesn't hurt to ask, because there may be something there to support you. And I thank you so much. Stay well and be safe.